Good morning. It's Dr. Brian McKay, Core Health Darien, and today I want to talk to you about the Back Pain Project. And basically, what the Back Pain Project is a culmination of many years. I figure almost 30 years of work dealing with back pain. And what we're trying to do is come up with the most effective ways to eliminate back pain and also to resolve the issues that are causing the back pain because right now it's very, very easy to get someone out of back pain for me. Like I said, I've been doing this for almost 30 years. So that's the easy part, but getting real changes and lasting changes has been more of a struggle, and that's where the Back Pain Project comes in. Typically, here's just one example, and we're going to go over today. It's called blood flow restriction. Now, it sounds like a bad idea to restrict blood flow, but we're only going to do it temporarily. And what happens with blood flow restriction is you do some weights. You basically you're not totally blocking the artery, but you're kind of starving large muscle groups, either the upper body through the arms. You would do it at the shoulder, right at the shoulder, where that little groove where your bicep starts is, or you would do it in the basically in the side of your crotch for lower extremity. So for back pain, what we've been doing is we have the patient. We first put the blood flow restriction cuffs on, and then we have them do a little cycling, like a warm-up cycle, and then we have them do some leg exercises. And the thing here is you're not using a lot of weight, but you want to do is you want to do like 30-40% of your max. Like say you can do a leg extension with 100 pounds. Well, you're only going to do about 40 pounds, and you're going to do about 30 reps, and you can do it pretty quickly to fatigue. And then you take a 30-second rest. Then you do 15 reps again, 30-second rest, 15 reps again, 30-second rest, 15 reps again. Now, not a lot of time. So when you take the cuffs off, the blood really flows into the lower extremities. And you got to think about is when someone has a back issue, you have to really be concerned with the whole entire kinetic chain. And the kinetic chain really starts at your belly button down. But here's where you can get that rapid blood flow going into, pretty much the glutes, the hamstrings, quadriceps, even down into lower leg. And what that'll do is that'll stimulate not only the blood flow, as you come on because it's starved of the oxygen, but it also enhances the nerve function as well. It's a relatively actually it started in Japan, and so it's I think you're gonna start seeing a lot more of it because it's an effective way. What if you just want to build muscle? That's one way to do it. Like if you want bigger biceps, you would just use the blood flow restriction cuffs on the arms. But it's more for like say I treat a lot of neuropathy cases as well. So you can use these things really to stimulate blood flow, and that blood flow is going to bring the healing benefits that oxygen will bring to the area. So it's like a short-term depletion of oxygen followed by a rush of oxygen, richly oxygenated blood into the area. So here's the thing: it doesn't replace regular training; it just enhances it. So so what some people do is you use blood flow restriction after your regular workouts. You're not going to just all of a sudden do you know light workouts and expect to be done. You do your whole workout, but then you get that rush of blood flow. So you sometimes want to use it after you perform your main workout, and you finish it with blood flow restrictions. That's the thing is, it's a great way to increase the training volume and the frequency without impairing your recovery because your recovery time is really very, very quick. So the idea is you can and you can increase the frequency. Like say you did this on an off day if you're really into building muscle. I mean, I think listen, it's great if you have the time. That's your proclivity is to gain muscle mass. It's easy to recover because you're using lighter loads. You're not really taxing the muscle. But it's a great way. Say you have an off day, like say you don't feel like doing any exercise today. Well, it doesn't take long to do this. So this is really helpful for people who are injured. Say you injure your knee is bad because we also treat a lot of knee cases with in the office here at Core Health, but we're using it across several different levels. and we're seeing really, really good results as far as the patients, the results with the patients, which is what all really matters. So if you have any questions on blood flow restriction, give me a call, 203-656-3636, 203-656-3636. I'm more than happy to answer any questions you may have. But you can look it up online, blood flow restriction, BFR. Men's Health has some great workouts that you could do to really, really pump up the muscles if that's what you're into. But I would suggest that you just give it a try. Thanks very much. Have a great day.